Hello, and welcome to the Penguin Trial. We'd like to thank you for investing the time to listen to the following presentation. The Penguin Trial is the third randomised controlled trial from the NIHR Global Research Unit on Global Surgery. The Global Surgery Network has specifically prioritised surgical intervention trials aimed at reducing post-operative surgical site infections, known as SSIs. Penguin has followed on from the success of Falcon and Cheetah trials. They're investigating different surgical interventions to reduce post-operative SSIs. Falcon is investigating the effects of preoperative skin prep with 2% chlorhexidine or 10% povidone iodine and type of fascial closures, non-coated or coated sutures in reducing post-operative SSIs. Cheetah is a cluster randomised trial investigating the effects of changing gloves and surgical instruments during surgery versus routine hospital practice in reducing surgical site infections. Penguin follows on from these two trials and investigate the effects of high and low oxygen concentrations during surgery on reducing post-operative surgical site infections. In addition, the trial will also investigate the effects of using a mouthwash before the induction of anaesthesia to reduce post-operative pneumonia. Data from the surgical outcomes studies identified patients undergoing major abdominal surgery in hospital pneumonia rates affects 1 in 30 patients. The incidence is greater in high-risk populations such as those undergoing midline laparotomies, where mortality rates are more than 10%. In addition, the Globe Surge cohort study identified surgical site infection rates were more common in middle-income countries and low-income countries. Therefore, the primary objectives within Penguin are to assess whether preoperative chlorhexidine mouthwash reduces the rate of postoperative pneumonia at 30 days compared to no mouthwash, and to assess whether 80 to 100% of fraction-inspired oxygen used during surgery reduces the rate of postoperative surgical site infections at 30 days compared to 21 to 35% of fraction-inspired oxygen during surgery. The secondary outcome measures within the trial will assess the effects of the interventions on death rates, readmission to hospital, reoperation, length of hospital stay, and return to normal activities 30 days after surgery. Penguin has been designed as an international, multi-centre, pragmatic outcome assessor blinded 2x2 factorial randomised controlled trial with an internal pilot designed to assess the effects of the trial interventions in low and middle income countries. For patients to be eligible for Penguin, they must be adults or children over 10 years of age in countries that allow children to participate in clinical trials. Scheduled to have elective or emergency abdominal surgery via a midline laparotomy with an anticipated abdominal incision greater or equal to 5 centimetres and given written informed consent. Patients who are undergoing a caesarean section, documented or suspected allergy to chlorhexidine, unable to complete post-operative follow-up, have been previously enrolled in Penguin within the last 30 days, or have an American Society of Anaesthesiologists grade of 5, expected to die with or without surgery, are not eligible to participate in the trial. Patients who meet the eligibility criteria for the trial will be randomised at the level of the individual in a 1:1:1:1 ratio. Patients will be randomised before anaesthesia and surgery to one of the following arms: preoperative chlorhexidine mouthwash and 80 to 100% fractional inspired oxygen during surgery, no preoperative chlorhexidine mouthwash and 80 to 100% FiO2 during surgery, preoperative chlorhexidine mouthwash and 21 to 35% FiO2 during surgery, no preoperative chlorhexidine mouthwash and 21 to 35% FiO2 during surgery. The aim of the trial is to recruit a sample size of 12,942 patients from 100 hospitals across 10 different low and middle income countries. Hospitals or medical centres that provide abdominal surgical services and can facilitate to deliver inspired oxygen concentrations between 21 to 35% and 80 to 100% during surgery will be eligible to participate in the Penguin trial. Patients entering the Penguin trial must provide written informed consent before participating in any study-related procedure. Consent must be taken by an anaesthetist or surgeon or research nurse, if permitted by country-specific regulations. Anyone taking consent must have undertaken trial-specific good clinical practice training and listed on the Penguin site signature and delegation log to take consent. Trial consent is in addition to consent given for the surgery itself. Children over the age of 10 can be consented to Penguin in countries where regulatory requirements allow the inclusion of children. After surgery, the patient will be followed up at 2 time points. The first time point is the time of discharge from hospital, and the second time is 30 days after surgery. Assessment should be performed by a member of the research team who is blinded to the treatment and occasion and is a wound assessor. The primary outcomes are pneumonia and surgical site infection rates at 30 days post-surgery. Therefore, the 30-day follow-up assessment is imperative for the assessment of the primary outcomes of pneumonia and surgical site infection. This can be performed in person or over the telephone. So to summarise, Penguin is a randomised controlled trial where patients are randomised to mouthwash and high concentration of oxygen during surgery, no mouthwash and high concentration of oxygen during surgery, mouthwash and low concentration of oxygen during surgery, or no mouthwash and low concentration of oxygen during surgery. Patients must provide consent before trial-related procedures are undertaken, and patients must be followed up at 30 days to collect the primary outcome measures. Thank you for listening to the Penguin overview presentation. If you'd like to participate in the trial, please follow the next steps. Assessment of site suitability, initiate trial setup processes, inquire about local approvals and contracts, provisions and completion of essential documentation, site initiation training, and complete site activation checklist and return to the hub or Birmingham Clinical Trials Unit. These processes will be discussed in greater detail in the Penguin setup process training presentation that follows on from this presentation. Please feel free to contact the Penguin trial team on the information provided on this slide. And again, I'd just like to thank you for your time, and we hope to hear from you in the near future. Bye-bye.